Straight talk on the risks, signs, and symptoms of stroke. Brought to you by Bixby Medical Center, member of ProMedica Health System.
Educating yourself about the risk factors most associated with stroke is the first step in preventing one. While the odds of having a stroke increase after the age of 55, it can happen to anyone at any age. On average, a quarter of all stroke victims are younger than 65. You may not be able to do anything about your age, but there are some lifestyle choices you can make that can greatly reduce your chance of suffering a stroke. Quitting smoking is a good place to start, as smoking can contribute to the development of abnormal blood vessel formation and clots. Equally important is getting high blood pressure under control. Hypertension, it is also known, causes systolic pressure to increase, which is one of the key triggers for stroke. Other things to watch out for include high cholesterol, obesity, diabetes, high red blood cell counts, sickle cell anemia, and the incidence of trans-ischemic attacks, or TIAs, episodes of altered consciousness that last as little as a few minutes or as long as a few hours. Your doctor can also listen for evidence of carotid bruits, abnormal sounds that often indicate partial arterial obstructions. There are also some risk factors you really can't do anything about. Stroke is more likely in men and in African Americans. And naturally, there's a greater risk for those who have had a prior stroke or who come from a family with a history of stroke or heart disease. Despite all this, major stroke can be treated in many cases, but it takes recognizing the signs and symptoms first, then acting quickly to contact 911, and getting to the hospital by ambulance as soon as possible. The most important thing to look for include unilateral paralysis, a condition where weakness, clumsiness, or heaviness is visible in the face, hand, arm, or leg. Numbness, defined as sensory loss, tingling, or abnormal sensations in the extremities, alone or in combination with the face. Visual disturbances, detectable by blurred vision or monocular blindness, where there's painless vision loss in one eye. Warning signs of stroke may also come in the form of vertigo, the sense of spinning or whirling. Diplopia, a condition where the victim sees two images instead of one. Diplopia can also manifest itself in the inability to move the eyes to one side. Dysarthria, or poorly articulated speech, even mumbling. And ataxia, the medical term for poor balance or coordination difficulties on one side of the body. These signs and symptoms can be subtle or readily apparent, but they should never be ignored. Calling 911 and getting to the hospital right away is the only choice in a situation where stroke is suspected. And once there, if you exhibit stroke conditions, you may have to make the decision to use thrombolytics, potentially the best option for treatment. The only medication that has been shown to reverse the damage of ischemic stroke, supporting recovery with little or no disability. Hopefully, you'll never have to make the choice. But if you do, it's important that you make an informed one. Please continue watching to learn more.
Thrombolytics, a tissue plasminogen activator, the one TPA for stroke. The sole drug approved by the FDA for the acute treatment of ischemic strokes. Thrombolytics has been used in more than 60,000 patients, generating favorable results for recovery, with minimal or no long-term disability or impairment. Thrombolytics work to dissolve stroke-inducing blood clots and obstructions in blood vessels in or leading to the brain, restoring blood flow and oxygen to affected areas. And it does it all without surgical intervention. As with any medication, there are questions that need to be answered before using thrombolytics. Why is it suitable for treatment? Who is eligible to take it? When should it be administered? And what are the risks? Until thrombolytics, there really was no drug treatment for ischemic stroke, and faint hope of full recovery, free from speech, vision, or neurological impairments. For many, thrombolytics has been a breakthrough, and with greater use, it will continue to be for thousands more. Thrombolytics may not be prescribed for patients suffering from a hemorrhagic stroke, a condition where a blood vessel bursts rather than becomes blocked, as in an ischemic stroke. Still, not all patients with ischemic stroke will be eligible for thrombolytics treatment. nor will patients who suffer from a prior hemorrhagic stroke, uncontrolled high blood pressure, or internal bleeding. To determine compatibility for thrombolytics therapy, patients are quickly led through a series of physical exams, health history evaluations, blood tests, and various neurological assessments. Then a CAT scan is performed to identify any pre-existing bleeding condition. If results come back positive for thrombolytics treatment and proper consent is given, physicians will act promptly to maximize chances for recovery. Thrombolytic stroke therapy must begin no more than 3 hours after the onset of stroke symptoms. If not administered within this time frame, the drug may not be effective and may cause increased side effects. Because thrombolytics is what's known as a clot-busting drug, there is a small risk of brain or other bleeding complications, as found in a 1996 clinical study sponsored by the National Institute of Neurological Disorders, which showed 6.4% of thrombolytics patients experienced early intracranial hemorrhage, as opposed to 0.6% of patients who did not receive thrombolytics. Yet the overall risk of death from stroke was no greater among patients treated with the drug and those not treated at 3, 6, and 12 months after the event. Physicians will take every precaution to ensure that thrombolytics is only prescribed to candidates whose test results and medical condition determine them to have the lowest possible risk of side effects. Thrombolytics, the one treatment that prevents brain cells from dying during an ischemic stroke, the one that provides hope of avoiding permanent impairment and disability, the one drug that may be your best choice. Thrombolytics, the one TPA for stroke.